We need confident and competent young nurses who like their job. Yes, we really do. But in reality, about 1 of 5 nurses plan to leave the profession after just a couple of years working. This is a reality in many European countries, so also in Sweden. At Sahlgrenska University Hospital in Gothenburg, one of the initiatives to strengthen young nurses in the profession is a trainee year for all employed newly graduated nurses. This abstract aims to describe how structured healthcare improvement models can be used to create a simulation-based program to target complex learning outcomes. And we'll use the work with designing a simulation program for the nurse trainee program as an example. In the trainee program, there was a tutor meetings and also a lecture program. But the stakeholders, clinical managers, tutors, as well as the nurses, felt that there were some critical issues about the working load and task management that needed to be addressed in a more interactive way. So the local simulation center at Sahlgrenska University Hospital was engaged to design a simulation-based program. And as we started planning and brainstorming around the program, we found out that there was a lot of complexity. There was a complexity in the learning goals, the clinical situations, but also a complexity because the nurses were working in very different environments within the hospital. So we decided to use a structured approach in the designing. So instead of thinking what kind of scenarios or clinical conditions or diagnosis we would base the program on, we started planning according to the improvement model of Institute of Healthcare Improvement with a little bit more holistic questions and issues. What are we trying to accomplish? And what change can we make that will result in improvement in the nurses' everyday life and learning? So we started the project with the planning phase with interviewing the stakeholders, supervisors, former lecturers in the lecture program, the tutors, and also the nurses. And the interviewing was a very central part of the structured approach. We noticed that the different representatives addressed different perspectives and also used different kind of describing and language. The stakeholders had a lot of diagnoses, regulations, some general values they wanted to be addressed in the course. The supervisors, lecturers, and especially the nurses provided a learner perspective, describing the circumstances and the feelings in everyday life that were challenging them. In improvement language, you would possibly call this phase for a root cause analysis to really understand the field. We call it assessment of needs. So not only talking about what patients or what diagnosis to target, but more to talk about why it was needed, why it was difficult, and what circumstances around the patient and about the nurses did make the situations challenging. So based on the interviews and the descriptions, we did a very detailed blueprint combining the different needs and the different perspectives, the medical perspectives and the ethical and communication perspectives into a 2-day pilot program. The first day dealing with the challenges in emergency acute situations, containing both clinical skills, communication skills, and ethics. The second day focused on non-acute but very common nursing situations that are challenging, not merely because of the medical or the skills perspective, but more because of competing interests and needs in the wardrooms, because of the surrounding circumstances. In the study phase, we did evaluation of the pilot courses with questionnaires for the delegates, with both numeric data, but even more important, free comments, written comments about the specific scenarios, workshops, and about the course in general. But we also did focus groups and meetings with the stakeholders, the managers, and also the simulation faculty. In general, the response was very positive, but there were also two main themes that emerged to be improved. First, some of the scenarios were a bit too simple, not possibly too simple in a medical way, but they were not arousing the complexity in the real life that was challenging. And the second, the nurses were very nervous before the simulation, and they didn't feel informed enough about the simulation, which affected the learning atmosphere, especially during the first day. So after the studying phase of the project, some adjustments were made in the simulation environment and especially in adding complexity into the scenarios. Some of the scenarios were adjusted so that the nurses were kind of forced to use more advanced devices, such as central venous catheters. Another example about the complexity is adding another patient played by one of the nurses participating, targeting the goal of how to prioritize, how to communicate with two patients with different needs in the same time in the room and within the team. Also, instead of information email before the simulation course, we added a pre-session with one of the instructors meeting the nurses and discussing with them common challenges and show the non-threatening mindset of the instructors. So did we reach our goals? The nurses loving their work and wanting to stay in their profession? Well, of course, it's hard to measure the effect of a 2-day course in a working life. But there are some studies going on that we hope to get some results soon. What we do know is that the participants and stakeholders are very satisfied, and it seems that we managed with a structured approach to target very relevant issues despite the various needs and the complexity. Since the start for about 1.5 years ago, we've had over 350 nurses participating in the simulation program, and the concept is spreading to other hospitals nearby. So the focus of the following PDSA cycles and the improvement project has been in training new instructors, training the faculty, and finding a good organization for the program. So our take-home message: embrace the complexity and use a model to see different perspectives and understand various needs, and especially the challenges and needs of the learners. Use detailed blueprints to target both theoretical, practical, and ethical perspectives that are present in every scenario in your course and in every scenario in the everyday nursing life. Thank you.